Our patients here just love coming here. They get one-on-one attention that they don't get anyplace else. They get to sit down with the doctor, review films where when they go to other places, I don't think they get to actually see their pictures, explain what is going on with them, and get answers and get to ask actually questions and know what their options are here. The great patients are, that when they're coming here, obviously they're sick, they don't want to be here, they're not feeling so good, they're scared, and we really hold their hand through the whole process. They come in and they're having a procedure, they're maybe having a biopsy today, not knowing what their diagnosis is, and unfortunately, it does come back cancer sometimes. Then they're coming back to us at that point for maybe a port placement. And the lucky, times we get to see the patients back and actually have the port removal done. And that's really good to be able to see a patient from the start of the process right through the finish. And by then they're pretty used to us, and it's just good to see them, and they're very happy to be leaving without a port. Patients come in acute pain, can barely walk. They're coming in to consult with us immediately. They're getting an MRI. They're finding out exactly what's going on. They have a fracture. We're normally seeing them the very next day for the procedure. When they're leaving here the day of the consult, they're being fitted for a brace, so they're leaving with somewhat relief. The day of the procedure, they're here for a total of 3 hours. They have conscious sedation. When they leave and they're waking up from sedation, their pain is normally 85–90% better that day. So, some patients cry and just can't believe that it was that easy to fix it. So that's probably one of the most amazing procedures that we get immediate relief from. If a patient has an HMO, when they're coming here, they obviously need to get a referral from their primary to see us, and at that point, once we have the referral, we handle everything from there going forward. So if they're having a procedure and it needs to be authorized, we're handling that. We're obtaining office notes, ordering imaging to support the procedure, and then we're following up with the insurance company. If they feel it's investigational, we're helping do the appeal process for that patient, and we'll do whatever we can to help them in that process. One of the procedures we do here is uterine fibroid embolization, and that is when patients are having heavy periods, pain, pelvic pain, and no relief, and not every woman wants a hysterectomy. That isn't everybody's choice, and for cost, for being out of work. And so we have a minimally invasive procedure they can come here for that only has maybe a 2-week recovery, and they're avoiding surgery. They're keeping their uterus, which a lot of women want to keep their uterus. So it's a good alternative that we can do here in an outpatient setting versus having to go to a hospital and have major surgery. Even though I'm the administrator here, I've actually been experienced on the patient side. My husband, David, had a herniated disc and suffered for 10 years with back pain. And I had a 3-month-old baby, and he's a stay-at-home dad, and it was getting very difficult for him to do the day-to-day things that you have to do when you take care of a baby. So I had suggested that maybe it's time we look into something alternative versus just pain medicine, and he did come in and have the plasma disc decompression, and had a lot of relief at that time, and increased every single day over the next 2 weeks. So he was able to cut his pain medicine more than half, and now my baby's 18 months, and he does a pretty good job keeping up with it. So it's great to be able to experience both sides of the job here.